Aftercare is really important because it is the main driver of promoting optimal tongue function after a frenotomy. Even though with a tongue tie release you may fix the anatomical problem, the function comes with the work that comes after the frenotomy. Aftercare also helps prevent reattachment, which can happen really early in the first 5 days after a frenotomy procedure. So it's really important to get in there early with your exercises. The latest, the morning after the procedure, and ideally, if you can manage it, once the evening of the procedure. It also helps to release and relax that built up tension that has arisen in the accessory muscles due to the tongue tie. Aftercare can be divided into two sections, mouthwork and bodywork. Mouthwork consists of a set of oral exercises that you do with your baby using a little finger in their mouth. And the second part is the sleeping tongue posture hold, which is a painless stretch that you do when your baby is asleep. Bodywork consists of tummy time, lots of skin to skin, and some nice gentle baby body movements. Next is a video of me showing you how to do some of these oral exercises. Now I'd like to demonstrate with this glass the suck exercises, and I picked this glass because it's transparent and you'll be able to see what I'm talking about. So first off, we get baby to open their mouth wide, and we do that by getting them in a relaxed position, having lots of eye contact with them, and tipping their nose and their upper lip especially, until they get in a position where they want to open their mouth wide. Then you introduce a clean short nailed finger until they start sucking. And once they're in a position where they're really happy and sucking away, you can start to rub their upper palate like this. The next exercise is called tug of war. So again, they're happy and sucking. You give a little jiggle or even a pull of your finger out of their mouth, not all the way out of their mouth, but a little bit, and then allow them to suck it back into the place where they're comfortable with it. Don't be worried if your baby gags. All babies and adults have a gag reflex. Just bring the finger a little bit far forward in the mouth. The next exercise involves bringing your finger down like this and pressing against the tongue. Okay, so just a few seconds at a time. Then you can press the sides of the tongue like this. So that promotes good strength on the lateral aspects of the tongue. And then finally, you brush your baby's teeth. So your baby doesn't have any teeth at this stage, but if they did, you'd be rubbing along the sides of the gums from the front to the back, either side. Okay? And then the final exercise, which is actually the most important suck exercise, getting back to sucking again and using your pad of your thumb on your other hand on your baby's chin and lowering until they lose suction. And then allow them to bring their jaw back up, sucking away and lowering. So what you're doing there is you're challenging the tongue, getting that tongue to work extra hard. And that is the suck exercises. For the slightly older babies, you might find that they don't want to suck on your finger, and this is because that primitive suck reflex leaves at about 8 to 10 weeks old. If that's the case, feel free to tap the nose, lips, cheek and lower the jaw and just have some fun with it, and that will be enough to get your baby's tongue moving. Here is a video of a mum doing a sleeping tongue posture hold while her baby is asleep.
Parent presses the soft underbelly of the tongue up to begin, then checks sleeping tongue posture. The tongue, at least the front and middle part, is up to the hard palate, gently pulling the tongue away from the floor of the mouth and encouraging frenotomy wound opening. Parent drags down on the skin of the chin gently until the suction breaks and the tongue falls from the palate. Parent reestablishes full tongue-palate contact and lip seal, and drags down gently on the skin of the chin until the tongue suction breaks. Parent repeats this several times in one session.
Next, let's have a little look at some bodywork videos. Here is a video of a mum doing tummy time with her child.
Mom and baby are engaging in social play. Mom rolls the baby into tummy time. She makes sure baby is comfortable. They play, interact, and practice head turning in order to exercise the tongue, jaw, and neck muscles. Mom encourages baby to use her arms to push herself up.
Push yourself back up. Ready?
She rolls the baby out, picks her up, and celebrates playfully while reinforcing the process of doing short bursts of tummy time frequently throughout the day. She lays her down for another roll into tummy time.
Another aspect of body work is simple baby movements, and next up is a really nice example of that.
Mom holds the right arm and the right leg with one hand. She holds the left arm and the left leg with one hand and rolls the baby side to side, allowing the cheek to touch the surface on each side that we roll to. Back and forth and back and forth.
You will know when to stop these exercises because your baby will be feeding well and their tongue will be moving well and their suck will be very coordinated. These exercises should be playful. You might even get to the stage where you're enjoying them, and they should never be painful, but in fact playful. So feel free to add in some variations of your own.